Hi, everyone. This is Dr. Christina Rahm, and today I'm going to talk to you guys about a subject that I think will be a lot of fun. We're going to talk about thyroid health, right? And that impacts all of us, really. Like I always have my thyroid taken when I go to a doctor. I do want to do the medical disclaimer first. So the information is provided for educational purposes and is not intended for medical advice or a substitution for the medical advice of a physician or qualified healthcare provider. You should not use this information for diagnosing a fitness problem or a health issue. You should always consult with a doctor or other healthcare professional on anything that you do or for medical advice. We do not claim to treat, diagnose, mitigate, or prevent or cure diseases. We don't claim to do any of that. We're here to help your body be as great as it can be. And our goal is to support human beings all over the world in their ability to be the perfect piece to a imperfect puzzle in this world. We say this all the time. You have to live the life you have the mission to do here. And that's important. And that involves your overall body, and your body's a city. And so we're talking about that a lot this year, how your body is a city and there's different components of it that handle different things. So for example, the thyroid health is a really important health aspect of your whole body. It impacts everything. So what is the importance of the thyroid gland? And if you can look at this deck, you'll see that it helps regulate metabolism. That's one of the most important things I think people don't realize. But if you've ever had hyper or hypothyroidism, you understand that it is that thyroid that's causing you to gain weight or to lose weight. It's part of the important part of the story of your health. It helps with energy production. So if your thyroid isn't working right, then the energy of your body is not working right, and you're tired and you look tired. The hormonal balance of your entire body is impacted by thyroid. So that's why you hear a lot about women with thyroid problems as they age, as they give birth, as they get older. These issues will sometimes pop up. I mean, they're genetic, epigenetic, cross interactions, different P450 interactions in the body with environmental triggers that are impacting the body and other things. These are really important and can really impact people in a negative way. The other thing about the thyroid that people don't think about is it's connected to the other organs in the body. So your heart, your brain, your liver, your kidneys, your reproductive system, the bones of your body are all impacted by this little thyroid, right? So it's important that it's functioning correctly. Your overall well-being is impacted by this. So I want to say that and let you guys think about it. Your overall well-being is impacted by this. So let's talk about the location. The thyroid gland is a butterfly-shaped organ located in the neck just below the Adam's apple. I was going to try to show you guys mine. And how it is in front of the trachea or the windpipe, which is really important. Like when you're a doctor or you're going in and you're doing an autopsy, you have to understand that because that's where the thyroid is. It is really in front of that windpipe and it's strategically located, right? So you have to be careful when you're dealing with it. It has two lobes, the right and the left, connected by a thin bridge of tissue. It does have two main hormones, the T3 and T4, which are your active form and your inactive form, that impact metabolism and are converted in the body, right? So they're really important because these impact your heart rate, they impact your temperature, everything about your body. So a lot of people, when they have thyroid issues, they notice temperature issues in their body or they notice energy issues. And it is controlled by the pituitary gland. So I had a pituitary tumor, and that does impact your thyroid. Like you can have extra growth or extra metabolism, but the pituitary gland releases thyroid stimulating hormones, TSH, which tells you how the thyroid, how much T3 and T4 are in it. So these are related. Again, everything is connected and it's very important. It loops back. All of this helps maintain balance in the body. So if this isn't working correctly, then you've got issues with all of those things happening within the body, or you can have issues. So what are different disorders? Hypothyroidism, which I talked about earlier, which is where it's an underactive thyroid, right? Hypo, which means underactive. Hyper means overactive. It's really reacting in a overreactive way. And you can get Graves' disease, which is an autoimmune disorder for this. Hypothyroidism can cause Hashimoto's, which a lot of people in our community struggle from. So both of those impact your body in a different way. You've got to have the balance, which is why it's really important to help your body do that on its own, or to support the body to getting back to doing it on its own. Sometimes you can't. Sometimes you have to be on pharmaceutical products as well. What are the structural issues that can occur from these disorders? You can have goiter or nodules, which can cause additional issues as well. It's often due to an iodine deficiency, but it can be due also to malignant or benign growths. So that's really important to remember. And then, of course, you can have thyroid cancer, which is where there's abnormal cells that spread. And this, of course, impacts the thyroid, but can impact, again, the entire body. So it's really important to talk about it. Let's go back to hypothyroidism, your Hashimoto's, which again, I know we have a lot of this in the root community, your iodine deficiencies, the post-surgical or radiation treatment can cause this. And the symptoms are, or can be related to it. So it's kind of interesting. This can cause this or be intertwined with it. And I think it's kind of interesting in science. I really believe that the root cause of things stem a lot, or not what we read in the textbook, right? But of course, I don't argue that directly and indirectly, all these components are kind of creating this cascade effect, which impact your overall body, either positively or negatively. So we've got to make sure we focus on positive things happening and not negative things. Common symptoms are, I talked about it earlier, the fatigue, the weight gain or weight loss. You can have, now with hypothyroidism, you usually have the weight gain. But I have seen patients that it's been different in that we can't explain it. We don't know why. So sometimes the symptoms don't always go with the diagnosis, but it is one of the things that leads to the diagnosis, if that makes sense. Depression, low mood swings with hypothyroidism, dry, flaky skin. A lot of times people with hypothyroidism think they have eczema, but they don't, or eczema, sorry, or psoriasis, but it's the thyroid. Constipation, weak muscles, all of that's related. Hypothyroidism. So let's make sure that we're talking about it. We talked about hypo, and then we're talking about what we do for hypothyroidism, and then we're going to get into hyperthyroidism. So with your blood test and you're diagnosing, you're looking at the elevated levels. You're looking at the pituitary gland. You're also looking at T3 and T4, and both, if they're low, it confirms a reduced thyroid hormone output. Thyroid antibodies are very important, and that means the presence of antibodies can confirm the Hashimoto's, which again is something that a lot of times people are diagnosed when they have this disorder. Imaging can also help detect it with the thyroid. You can look at the different imaging, but this diagnosis goes along with really the characteristics of hypothyroidism again. There's different treatments you can do. There's levothyroxine, which is a synthetic form of T4. People ask me what I think about it. I understand patients need it. Some of them use it. Some of them it really helps. Some of them it doesn't. Some have reactions. Everyone's different. The dosage and monitoring depends on the individual age and their regular blood tests and the levels. There's also natural treatments that can occur, but this is one of the main things that people use to treat this disorder. Hyperthyroidism, let's switch to that. It's an autoimmune disorder with the immune system that produces these antibodies. And when that happens, the hyperthyroidism is diagnosed as Graves' disease. And Graves' disease is something that, again, is more common than you think. The most common cause, though, of Graves' disease is hyperthyroidism. But I want to explain this again so people understand. A lot of times people are diagnosed with hyperthyroidism and then Graves' disease, or vice versa. So if you wonder why your doctor is prescribing or diagnosing you with one or the other, it's because everyone does this a little bit differently, depending on integrative med, functional med, traditional med, nutritionists, nurse practitioners, people in other countries, they all look at this a little bit different. The hyperthyroidism, where you also have a diagnosis of thyroid nodules, that's a little bit different. That's a benign growth that usually has a toxic multinodular goiter or single toxic nodule. It produces this thyroid hormone that really independently regulates body control. So that can be an issue, right? That's something that you have to look for. Common symptoms of hyperthyroidism or Graves' disease are weight loss, rapid heart rate, which is very, very common, sweating and heat intolerance, nervousness, anxiety, And you can have tremors, your hair can thin. Like a lot of times people will have issues with their thyroid and they lose their hair. Increased bowel movements is another thing you can see. And then again, in Graves' disease, you see the bulging eyes. I know you guys have seen those. And people ask me, can you reverse it? It's a longer process than that, but you've really got to focus on your overall body, cleaning the toxins out and supporting the overall body. With hyperthyroidism, you do blood tests, you do TSH levels, T3, T4 levels. If they're elevated with T3, T4, then that's confirming hyperthyroidism. If you have a low TSH level, it looks at overproduction of thyroid. So those are giving your diagnosis to hyperthyroidism. And they also do, again, imaging like they do with hypothyroidism. There's anti-thyroid medication, such as PTU and methaconazole. They block the thyroid from producing excess hormones. There's also some natural things that people use, but this is usually the first line or temporary management treatment if this is a diagnosis that you have. Radioiodine involves taking radioactive iodine pills that selectively destroys the overactive thyroid cells, and that's something that people sometimes use or that doctors prescribe. Common and effective, but this may lead again to hypothyroidism. So you have to be really careful with that treatment. And then of course, there are partial or total removal of the thyroid gland. Severe cases with goiters, there's other treatments that they have to do. Post-surgery, you usually have to do hormone replacement therapy. So surgery is not always the first option when you have this diagnosis. When you look at thyroid cancer, there's lots of symptoms that you see that doctors use with that diagnosis. They see a lump on the neck, difficult swallowing, persistent hoarseness, breathing difficulties, rapid growth of the neck. There's lots of different things that you can signify when you have this issue before it's diagnosed. So you have to pay attention to those things. But thyroid cancer is not that typical. It's something that doctors will diagnose after they go through and check out the other boxes and see if it's not that, then they look for the cancer or if they feel the nodules. The prevalence, the most common type is papillary thyroid cancer, and it's about 80% of the cases. It's slow growing and it's highly treatable, which is what's so great. And it's excellent high survival rate. Follicular thyroid cancer has favorable detection. It has favorable treatments at an early detection rate and favorable results, right? So that's something that it's often curable. It's the second most common type of cancer with 10 to 15% of the cases. Medullary thyroid cancer is representing 2 to 4% of the thyroid cancer. It can be connected to a genetic test. The diagnosis is different with every person. Sometimes there's good variable, sometimes there's bad. It is something that your doctor will catch, but usually it takes a while for them to catch it after doing multiple tests. Anaplastic thyroid cancer is extremely rare, less than 2%. Very limited treatment options with this one. It's harder to treat, rapid growth, and it spreads very quickly, but this is very, very rare. And I want to add that so that people know. When you talk about thyroid cancer and treatments, there's what we talked about earlier. There's the surgical treatment, which is partial or you remove the thyroid. There's lymph node removal, which they've seen favorable results with that. This is when the cancer is spread near the lymph nodes. Then they also have the radioactive iodine therapy that we already talked about. That's called RAI. And that is used post-surgical to destroy all these cells that really shouldn't be there. You think of them as microscopic cancer cells, right? That are really hard to detect, that you need to get rid of. Chemotherapy and targeted therapy are also something you can do for thyroid cancer treatments, and beam radiation therapy is another therapy that's often used. The dietary tips for thyroid health apply to everyone, not just people that have hyper or hypo or Graves' disease or Huntington disease or cancer. We all should be protecting our thyroid, and we know that nutrient-rich foods are required. Selenium, iodine, zinc, those all really help support the thyroid and support the overall body. So it's really important that you have the right amount. You can get those in different foods or different supplements. At the Root Brands, we do a lot of supplements where that is in the grains or that is in the formulation so that people have that. And of course, I think a lot of supplement companies do that because we understand that these are critical things that the body needs. and that the body can't function effectively unless they have selenium and iodine and zinc and different things that they really need to really protect the thyroid and help it function appropriately. You should avoid excessive things like in some raw vegetables, you have a lot of things that when you really cook with them, it doesn't help the body quite as much. So you have to be careful that you either if it's raw or if you're cooking that you do it in the right way. And so you really don't need excessive amounts of certain things. I talk to people about it a lot. Like I'll give you an example. I love broccoli. I love cabbage. I love kale. I love cauliflower, but you have to balance. It's like everything. I talk about supplements. I talk about vitamins and minerals. You're balancing everything in your body. You don't want, in fact, you can drink too much water, right? You can eat too much salt, as we all know. And, you can have too much protein or too much meat. So you just don't remember that this applies to everything in your life. You have to balance the nutrition components of what you're eating. And gastroengens, which is something that can really harm the thyroid, that's something you do have to balance when you're eating. You have to make sure that you're really looking at what you're eating and how that impacts the thyroid and the overall body. You need to limit soy products. I tell people that all the time, and they don't realize that when you have a problem with the thyroid, you really need to regulate. Stress management's important. Working out is important. You want to tune into the workouts with Dylan Cravens if you want to see some great workouts. Reduction of stress is important. Stress is really critical to your overall health, emotional, mental. I just did a podcast with Dr. April Spencer, who's an oncologist in Atlanta, and we just talked about how your emotional, mental stress really add to your physical stress, whether you have cancer or not. You've got to remember, get that stress out of your life. Now let's talk about the root products. I think all of our products support overall health. I don't think there should ever be a claim that the products that I've worked on are going to solve everything or even anything. It's there to solve your body's needs. Your body needs nutrients, vitamins, and minerals. It's really simple. And it needs to make sure that everything it puts in its body has been cleaned, that the viruses, the bacteria, the parasites, the fungus are cleaned out, and that it's there to clean the entire body while supplementing the body. And that just is healthy food. What nutritional supplements are healthy food. But when you've washed them and cleaned them and tested them and gone through everything you can, then that food becomes such a vital thing to your body. It used to be that medicine was all from natural things. Now there's a huge synthetic component to that. And I always say, I'm not talking bad about pharmaceutical or nutraceutical. They all need to be tested. They all need to be reviewed. You need to make sure you use things that are right for your body. You can't claim a pharmaceutical is going to cure someone, and you can't claim that a nutraceutical is either. Nutraceuticals are really there to feed the body. You've got a city in here. So in order for your thyroid to work, your brain, your neurotransmitters, your heart, you got to feed that city with the right things that have been clean and are going to make that city brighter and better on the inside. Clean Slate is bioavailable silica, which was cleaned, and then trace minerals and vitamins added. So I think it's an extremely important product to add to your regime if you're really trying to clean the inside of your body. For me, it's instrumental to what I do on a daily basis. I take a bath, I brush my teeth, I take Clean Slate. Restore is something everyone's heard me talk about. I'm working in 92 countries, going to the Middle East, going to Asia, going to India, going to Africa, going all over. I became really familiar with black cumin seed oil, with resveratrol, with turmeric curcumin, studying all the stuff that raspberry ketones can do, and apple cider vinegar and aloe vera. It was really important to put it in a pack where it could go into the body, be bioavailable, safe and efficacious, and really impact the body overall. Zero In is a product that's really there to focus on your body zeroing in. Thyroids can cause issues, can cause you to be groggy or not as cognitive functioning as you are if you don't have a thyroid issue, because it makes your mind foggy, and it also impacts energy and metabolism, all of it touching the brain in some way and touching the overall body. Zero In is a product I recommend if you really want to improve how you're focusing on things. I think it's really important. We all have different ideas of what focus means and how that helps our bodies. For me, doing something naturally is better than taking something synthetically, but I also understand there are people that need to take a prescription to help them function. From my perspective as a scientist, please start with something natural that can help you really use your best qualities of your brain and of your body to complete the mission that you have in life. Remembering again that you are so very important to this overall picture in life. Your life matters, so you need to think and perform at the highest ability that you can. Natural barrier support, because of the vitamin D3 and zinc and vitamin C, are really important. Balancing that by taking an amount that you put into water or into a shake or food. Remember, sometimes that needs to be taken with food because it is in the raw, and it does help with the microdosing of the body, really eating up the negative things and supporting the good things when you have the right vitamins in your body. So vitamins are essential to and imperative to the success of this city inside that is helping you live this life on this earth. Immune Defense Shield, I can't say enough good things about it as far as why I think it would matter to an individual that wants to support their overall health, including a thyroid. Vitamin K2 is so important. Vitamin D3, C, magnesium oxide, Omni AC, quercetin, and NAD. And I'm reading those because all of those synergetically being used together, again, supporting the overall genetics and epigenetics in the body are what are so important. And that's what food does. That's what food supplements do that are made the right way, but you've got to know the source. You've got to know that it's processed the right way. You've got to understand that it's clean for your body, because your body needs the very best you can give it. There's only one you to protect the inside of the body. So that has to be your mission. Sculpt is another one. Everyone knows how much I care about this product. If you listen to me, I think being able to give you ingredients like ginger root, white kidney beans, valerian root, astragalus, panax, all the different things that are in there to really help the body with the maintenance of sugar and the maintenance of carbs, I think is very important. This product was not just made to lose weight. This product was to help to manage and balance the inside of your body so that the nutrients, the proteins, the sugars, the carbs are in balance. That was the goal when I made the product. As far as references, there's tons of references as it pertains to how you can help your overall body. I want to remember to myself and remind you guys that even your skin is important. So protecting the skin, protecting your body, protecting the shell for this beautiful city that's inside, that's your goal to really make function at its top priority and top level. That's your goal, and hopefully these products will help you do it. Your thyroid health is important, and that's why it's important that you put the right things in your body to support it. Thank you, everyone. Have an amazing rest of your day and week.